We're live.
Happy Tuesday, everybody. Welcome to the next in our community wellness forums, the Complete Wellness Community Forums, which are Monday night, 7:45 coaching, Tuesday night, 7:45 functional wellness. That's tonight with Diana, and 7:45 on Wednesdays with Jan, although I think this week Jan is not happening because of the holiday. But these are Monday, Tuesday, Wednesday night, 7:45 until 8:15, and they're free. They're our attempt to serve the community a little differently, a little bit better, a little deeper, if you will. There's no charge. You don't have to be a patient to attend. So tell your friends if you think that they would benefit from it, etc. So Diana is our functional wellness registered dietitian nutritionist. 5 things. And she is a wellness guru. And I don't give out that title very often.
Wow, I'm honored.
Thank you. And we've talked about a lot of things. This is our 4th or 5th forum. I forget exactly. But last week, I should say, we dove into the gut. We've spoken about hydration. We've spoken about hormones. But last week, we started to talk about the gut. And the gut is a very deep issue. Is that a bad pun? Yes, it is. But it's very complex, and it affects many, many different parts of health and wellness. So I would like to devote a few shows to this, a few podcasts to this. As I said, we started last week, and we're going to continue this week. Last week, we spoke a little bit about the anatomy of the gut. What exactly is the gut, the small intestine and the large intestine? So that means from the end of your stomach until you poop it out. And we talked about probiotics because I think probiotics is an interesting sort of buzzword. Everybody knows it, but what is it really and what's it about? And I think it might be good to touch upon it again for a moment, Diana. First of all, what are probiotics?
So
let me take that back.
No. But I have a good analogy for this whole thing.
Fire away.
So we think of the gut like a garden, and so you have good bacteria and bad bacteria in the gut. In a garden, you have flowers and weeds. And so probiotics are the good bacteria of the gut. And so we create them, we isolate them, we dry them, we put them into pills. We hope that they stay alive and we take them. And what is that doing? That's planting flowers, planting good bacteria in the gut. And that's really important for metabolic function, for digestion, for immune health, for mood, you name it. And that's why there's so many different probiotic species that help with so many different ailments. Now, what doesn't get discussed enough, in my opinion, is prebiotics, which is like the fertilizer for the garden, for these flowers. And so if you take a probiotic every day, some people feel better, some people feel worse, it's because you need certain types of flowers depending on your gut environment. And so with probiotics, you're taking them and you're basically putting that flower into your garden, versus prebiotics are actually creating more flowers naturally by basically fertilizing that garden. And so if you take a probiotic,
like prebiotics would be better.
And personally, I find that they are, and people feel better because you create your own flowers, versus probiotics only last for as long as you're taking them.
So,
not to say you shouldn't take probiotics, people feel better with them, but if you're not having enough fiber, which is prebiotics, coming
Are there
from
any other prebiotics or just fiber?
fiber. Different types of fibers are the main prebiotics out there. They come in, there's tons of different types of prebiotics, but they're all derivatives of fiber.
Got it. And can you take prebiotic pills like you can probiotic pills?
You can, but it's most common, you totally can. It's most commonly in fiber powders.
And what are some of the symptoms that someone might be experiencing if they have a prebiotic, probiotic,
Deficiency.
bad situation?
Dysbiosis.
Deficiency, bad situation. Let's not
Too
even put
many
a
weeds,
name
not
on it.
enough flowers. So the most common thing that we think about is gut issues, right? Constipation, diarrhea, gas, bloating, cramping, pain. And that's more obvious. And usually people come in, they go to a gastro, they're like, my stomach hurts, right? There's something off. But what's more common is that gut issues become systemic. And so they can.
Wait, before you do that. This person who has a gut issue, too many, too few, wrong thing, right flowers, wrong flowers, weeds, whatever the heck is going on with them. And they go to their regular doctor or a GI doctor. What's the typical thing that a GI doctor will do for them if they're constipated and unhappy?
So it's the pill. It's honestly a pill for an ill model. So if you go to a GI doc and you say I'm constipated, you will get laxatives. If they're good, they'll give you magnesium, but they'll give you something to push you to go without figuring out why you're constipated in the first place.
Are there times when you really just got to make the push to go and then fix it?
Yes, because you could literally have way too much impacted stool that actually causes an issue. So you might need an enema, you might need an actual laxative to push through it for sure.
Got it.
But it's just going to happen again if you don't figure out why it happened.
Right, of course, if you don't solve the problem, just covering it up with a Band-Aid, it's still there.
Exactly.
Got it. So those are the common symptoms, and that's what happens generally medically when you go that route. Got it.
But there's more than just the gut symptoms, right? So it can manifest.
Okay, so that was the next thing you're going to say. So that's
Yeah.
if someone's having local symptoms.
Which consider yourself lucky if they are local, because it's
only local.
Yeah.
So now what are some of the systemic symptoms that you see from gut issues?
Joint pain, autoimmune conditions, mood disturbances,
Can we go through those one at a time?
Yeah.
So the first one you said was joint issues.
Yes, joint pain especially.
If my back hurts, it might be from my gut.
Yes. Oh, someone says hi. So yes, because there are certain bacteria that have been known to trigger certain autoimmune conditions, but also, and like one of them being rheumatoid arthritis, that's why I was thinking of that one. But also when there's this imbalance of bacteria in the gut, it can cause us to start reacting to certain foods, reacting to certain things in our environment. And sometimes how that tells us that is through joint pain.
Wow. Can I type here? How do I type in the chat? Well, I was going to say hi to Andre, but I can't figure out how to type. So, hi, Andre.
Say hi for you.
Thank you. Yeah, but someone has back pain. They should go to a nutritionist. That's so sort of counterintuitive.
I would say if you have back pain and right, you might be walking into complete wellness. If structurally you can't figure it out, right, you've been on a whole journey, then I would definitely look into the gut, but I'd also look into nutrient deficiencies since low vitamin D has been linked with back pain too.
Got it.
Or inflammation in general.
Well, just to talk about us for 1 second, what we do at Complete Wellness is try and cover all of the bases, right? Complete, that's the answer. Not just local, but complete, because a person could have, and this is what I find all the time, a combination of
Yep.
a structural mechanical issue with a, let's say, digestive irritation or a stress irritation. And that combination of factors is really where things start to get bad for them. Okay,
Exactly.
and certainly if someone is having full body joint pain, I picked low back pain because that's one area.
Mhm.
But if someone is having full body joint pain, that points to something usually other than a mechanical issue, because there are not a lot of mechanical issues that implicate the whole body. I mean, it happens, but
And that could be due to inflammation, right? Which could be due to something you're eating, something you're getting exposed to in your environment, stress, or it could be due to dysbiosis in the gut, which is an imbalance.
Wait, what's that word?
I'm explaining.
That's it. That's a new word.
It's an imbalance of good and bad bacteria. So it's too many weeds, not enough flowers. And so that in itself can cause inflammation.
So you could be taking probiotics and still have a dysbiosis.
Absolutely. First of all, depending on the type of probiotic you're taking, if it's not third-party tested, it could be dead. So it could be doing nothing. It has to survive our stomach acid. It has to survive like our whole GI tract, and it has to survive the actual processing of it, putting it into a capsule, and then getting it to your home. So a lot of these probiotics don't even make it, which is why you want to have a probiotic that's third-party tested. But that's put aside. You have to know which type of probiotic your body actually needs, if it even needs probiotics. Some people I see just have like an overgrowth of way too many flowers and the garden's getting overcrowded. And then probiotics make them feel worse. So whenever people are like, what probiotic do you recommend? I'm always like, we need to see what's going on inside before I can say that.
And how do we do that?
So we do it through a gut test. We use the GI map, which is a stool test that you collect in the comfort of your home.
Oh, that sounds lovely.
It's lovely. And so
it's not as bad as people think it is.
No, it's quick and painless. One collection, mail it into a lab, and then we'll get a whole breakdown of your microbiome.
So you'll find out how many weeds I have, how many flowers I have, exactly what's going on with the whole situation.
Exactly.
Do I have enough variety of flowers? Wow, amazing. So that seems like that should really be one of the first things that we do when someone has a dysbiosis.
It always is. If you come to me, if you're my patient, you will, if you have GI issues or you have anything else that's systemic, I will push the GI map. Because I think it's incredible and gives us so many answers that it's hard. I always say, like, don't guess, test.
I just out of curiosity, does insurance pay for the GI map test?
It doesn't, which is unfortunate. No. The reason being because what we're finding, with the exception of the first page, which is what like a typical gastro would test for, like salmonella, E. coli, like the usual scary foodborne pathogens, the rest of the test is the markers are not a diagnosis. I am not diagnosing you with dysbiosis, unfortunately. So there's no diagnoses that we can give somebody. And there's no like necessary like antibiotic treatment or like some sort of medication. And therefore, like, I don't think insurance knows what to do with it, to be honest.
Got it. So how much is the map test, GI map test?
$379, but we offer payment plans.
We have payment plans. So you don't have to pay it all in one shot.
Yeah, no, you can pay it over 4 months.
So certainly it seems like it's worthwhile if someone is not feeling well in terms of their digestion, has tried other things
Mm-hmm.
and has not gotten their answers, seems like you need to dig a little deeper, and the GI map test might be a good investment in their health.
Yeah, if you've gotten a colonoscopy and endoscopy, you feel like you have no answers, you feel like you can't digest your food, you feel like you have increasing amounts of food sensitivities, or you just don't want to be on a medication like laxatives or antispasmodics for the rest of your life, right? You want to figure out what's going on.
Got it. So if you want to go deeper, it's a $379 investment, and we take payment. We have some payment plans.
Highly recommend it.
Highly recommended. Good to know. So we were talking about symptoms, joint pain. What are some of the other systemic issues that you see from gut issues? Like the most common ones.
Trouble losing and gaining weight or gaining weight.
Or gaining weight.
Mm-hmm. For somebody who, well, first of all, if you're not digesting and absorbing your foods, you could be pretty malnourished and it's hard to gain weight.
And you need probiotics, the bacteria in the gut, to digest the food properly.
Yes, but the stool test also looks at more than just the good and the bad bacteria. It also looks at, or the flowers and the weeds. It also looks at digestive enzyme markers, the ones that are secreted from the pancreas. It also looks at like fat malabsorption, if that's an issue. It looks at inflammatory markers. It even looks at gluten sensitivity, which is a crowd favorite. But there's a lot more to it that gives us a good understanding of your overall digestion. That's not only tied to the good and bad bacteria, although that does play a huge role.
Gotcha. Good. So systemic issues like
anxiety and depression, big one.
Big one.
A lot of people with anxiety and depression have digestive issues, but even if they don't, over 90% of our serotonin, our feel-good hormone, right? If you're taking an antidepressant, it's helping you release more serotonin. And over 90% of serotonin is made in the gut. So if you have gut issues, serotonin and other neurotransmitters too, dopamine, are not getting made. So you might notice you have a harder time focusing, you have more anxiety, you have depression. The catch is you have to heal the gut, and then those neurotransmitters start working again.
How long does that usually take?
It can honestly take this is such a broad time frame because it really depends on what's going on, but 3 months to a year.
Wow.
Yeah. But it is so worth it because you look back a year later and you're like, a lot of people look back a year later and they're like, wow, I didn't make any change, versus, wow, look how far I've come in a year.
Of course. And the alternative is being on meds for the rest of your life.
Mm-hmm.
I have a dumb question.
Ask it. Nothing's dumb.
Why doesn't the medical profession send people for gut testing?
It goes under the same thing of why it's not covered by insurance. There's no diagnosis. If you have an imbalance of good and bad bacteria, there's honestly no medication. And that's their toolbox. And you can't blame them, right? That's what they have, is medication to treat a disease. If you have dysbiosis, that is not a disease yet, right? Leaky gut, intestinal permeability is becoming a disease slowly. It will be in 5 or 10 years. Maybe dysbiosis will be too, but it's not it yet. And that's where science and like functional medicine is just ahead of the time. They say it takes an average of like 10 to 15 years for emerging research for what we're studying to actually get into the medical school books.
But if this is science, which I assume it is, who cares if the insurance company pays for it, doesn't pay for it? Most psychiatrists don't take insurance anyway.
Well, if you're talking about psychiatrists specifically, I just don't think they're trained in this model. I mean, neither are
They don't know.
Yeah.
Even though it's been shown in the medical journals.
Yes.
Well, that's upsetting.
It is. It's extremely upsetting. I think anyone in kind of the functional medicine field feels this way, because you have to be proactive and you're looking for things that are causing issues, causing symptoms that are not necessarily causing disease. And that, I find, is where this gap is, where the division lies. Because 90% of the people that come in, they might have like certain diseases, right? But they aren't being diagnosed with Crohn's or colitis. And even if they are, there's a lot you can look into. But if you don't have that definitive diagnosis, you're kind of left like wondering what to do, because the medical field just doesn't really know what to do other than give you a laxative or something that'll back you up a little bit. Unfortunately, it's crazy.
Got it. It's unfortunate for the patient.
Mm-hmm.
Okay, one more top systemic disease that you see. You said joint pain. By the way, if there are any questions out there, feel free to chime in whatever chat you're on, in whatever platform you're on.
Let me name a few, and then you tell me which one you think you want to hear about. Food sensitivities, skin issues, autoimmune conditions, brain fog.
Skin issues.
Acne, eczema, psoriasis, rashes.
So acne. Patient comes in with acne. They're put on
doxycycline.
Doxy, or there's another one. I can't think what it's.
Accutane.
Accutane, thank you. And sometimes teenage kids are on that for years. Mm-hmm. Why do we see acne more commonly in the teenage years if it's a digestive issue?
So because it's not always a digestive issue, for some, it's actually a hormonal issue, especially in the teenage years. It can go either way, right? And depending on the type of acne, you can kind of tell which one it would be. Although if your gut is not working properly, your hormones are going to be out of whack. So if you have any gut issues or signs of gut distress, you got to go there first before you dive into treating or managing hormones.
Why would a person, I guess the imbalance answers the question, but a person eats well. We're not talking about a person that's eating junk food and tons of sugar and all that stuff.
Yeah.
How would they get dysbiosis?
So there's a lot of different influences on the microbiome. One is your environment, chemicals, where you live, what you do. Another one, I'm going to go through this kind of quickly, so if you want to stop me. The next one is genetics, right? As I said before, you inherit your microbiome from your family, right? Your mom gets it from your grandma. You're then in your mother's womb. You inherit some of it then you pass through the vaginal canal. You get even more. So, right, it's very genetic in that way. Also, your lifestyle, your diet, exercise, stress can change your microbiome. How you were born, right? Were you born via C-section? Were you born via like a vaginal birth? Were you breastfed? That influences your microbiome. And then like various, honestly, medical practices, medications, various, prescriptions, things that we might have done, like removing the appendix, which is a very important house of the good bacteria. Kind of falls under that umbrella. But yeah, there's a lot of different components that can lead to dysbiosis. Those are a few.
Wow. So going to the dermatologist and getting an outside-in answer to an inside-out problem really makes no sense.
Yep. And it's why a lot of people don't see relief from dermatologists. Unless it really is like ringworm or like an infection on the skin, but even that.
Or a contact dermatitis.
Yeah.
Interesting. And of course, the dermatologists don't do this either because it's not in their game.
Correct.
Got it.
One day they will, though.
We're at 10 after the hour. So I just want to introduce the issue of leaky gut. There's so much out there being spoken about. Leaky gut. What the heck is that?
So
I only got 5 minutes, so you're just going to introduce it.
Okay. So basically, I'm going to give another kind of like analogy in that the human gut usually looks like this, right? It's tight, it's sealed, it's closed, and these are the
What do you mean
junctions.
it looks like that? The walls look like that?
Yes, right.
The
This
walls
is the
of the-
gut. It's a very enclosed space. You cannot leak out from the gut. Nothing gets out through the gut. Food passes through. Nothing except nutrients are leaking through the gut lining because it's very tight and sealed.
And is it not a closed tube?
It is, but there's microvilli that sit in the, I'm not very good at showing this, that sit in the gut lining that help you digest and absorb nutrients that bring them into the bloodstream, because you do want your nutrients to get into the bloodstream. However, over time, there's a pesky protein that, when triggered, and we'll go through into triggers later, can actually make the gut lining go from like this to like this.
We're talking small intestine or large intestine?
We're talking, honestly, either one.
Small. It's mostly small.
Oh, it is mostly small? Oh. Okay, there you go. So basically it starts to go like this, and then various bigger proteins, like the turkey you ate earlier today, or
how'd you know I had turkey? I did. I had turkey for lunch.
Oh, really?
Yeah, leftover.
I guess I did.
Friday night.
Me too. That's why I was thinking. So these big proteins start to leak through the gut lining and into the bloodstream. And so what happens is you start to create an inflammatory response. And that's why like people start to get more food sensitivities, because all of these various larger proteins start to leak through the gut and you start to get symptoms. Gas, bloating.
Didn't you just say you want the nutrients to go into the bloodstream?
Yes, you want the nutrients, but you don't want the food proteins themselves to get through.
So
or bacteria or toxins or anything to enter the bloodstream. Think of it like if this is a cheesecloth, and then all of a sudden the cheesecloth gets like, right, so like cheesecloth, only like the things you want get through. But then the cheesecloth gets slightly ripped over time, and then larger items start to get through that you don't want them to.
Got it. Okay. And so that's what leaky gut means. Your gut is leaking, literally. I'm not going to ask you how we treat it. I'm not going to ask you what symptoms it causes, because we're just introducing it tonight. We're looking to whet people's appetite with the concept of leaky gut. I only have one question. How do we test for leaky gut?
So there is a specific marker that you use to test, which is, as I mentioned earlier, there's that protein that sits on the gut lining and causes your gut to go like this. And that's called zonulin. So you can test zonulin levels. If you have high levels of zonulin in the gut, it's likely that your gut is leaky. But you don't even need zonulin to tell you that your gut's leaking. If you have dysbiosis, if you have bacteria, parasites, yeast, fungi, poor immunity in your gut, you can see that there's likely leaky gut, and that's the reason why. People always say, do I have leaky gut? Do I have leaky gut? It doesn't really matter if you quote unquote test zonulin or not. When you have anything going on in the gut, oftentimes that's a sign that you have leaky gut, or that's a cause for it. And so we have to get rid of the root cause of the leaky gut, not just try to close the gut lining.
Got it. Clearly, this is a complicated issue. So we are going to pick up next time on the leaky gut and all of its causes and all of its manifestations and all of its symptoms, etc. Are there any questions before Diana and I disappear into the night? Seems like no.
If you have questions, though, before next time, reach out. we'll make
If
sure
you
we
have
answer them.
questions, feel free to reach out. If you would like to come into Complete Wellness to get worked up as a patient, whether you're having back pain from a mechanical issue or a dysbiosis or not sure what it is, feel free to come and check us out. Diana and I will be here again next Tuesday night at 7:45. Jan, usually Wednesday, 7:45 to increase your stress resilience. And Monday nights is my coaching forum, where I coach you to go from one level to the next level in whatever area of your life you're looking to do that in. Thank you, Diana. As always, a pleasure.
Thank you. Thanks everyone for joining.
Thanks, everybody. We'll see you soon.